Good evening, good people. It is me. It's the good Dr. Nick, Dr. Nicole Alford, clinical psychologist extraordinaire, right here in the DMV. Happy Thursday, happy Friday's Eve. I'm so glad and excited that you would join me because tonight we're going to be talking a really important topic for Minority Mental Health Awareness Month, which is July, the entire month of July. Uh, we are going to be focusing on getting your head right, keeping your head in the game so that you can continue to do what you do, continue to make impact, continue to be a blessing and contribute to your family, to your job, to our community, and globally writ large. So I want to talk to you a little bit about how to find a good therapist, not just how to find a therapist. That's a piece of it. But I want to talk about how to find a really good therapist. And again, this is a super important topic. I know this for a fact as a clinician, number one, because many people continue to reach out to me and ask me for assistance and for help in finding a therapist. Number two, we know that these times are tough. These are tough. These are irregular. These are unprecedented times. We know that we have people that are living in fear. We have people that are anxious about the economy, maybe about immigration and how that might impact their families, their lives, their friends, their network, about their safety. We have people who are afraid to send their children to school because of gun violence, because of school safety issues. Maybe immigration there has a nexus as well. So these are just really unprecedented times. What I found in my clinical practice was that depression is at an all-time high. Anxiety is at an all-time high. And of course, trauma, PTSD, hypervigilance, those types of issues. So I want to talk how to find a therapist. And here's the thing. All mental health clinicians are not created equal. If you don't remember anything else about this live, I want you to remember that. All mental health clinicians are not created equal. Here's what I mean by that. The definitions, for example, of a psychologist or a psychiatrist or a licensed professional counselor or clinical social work, they're all codified by law. The law in every single state that that person practices in defines what they can do, defines the credentials and the expertise that they must have, and that they must pass an exam and have a license that's active in order to call themselves that, whatever that is. Psychiatrist, psychologist, mental health licensed counselor, it doesn't matter. And so they're not all equal, obviously, right? And so the law says that, and their education and their experience and what they can do says that. So my first tip is this, and I'm going to give you probably about 4 tips tonight. My first tip is this: know what you're getting. If you go to a psychiatrist, you're getting a medical doctor, you're getting an MD, you're getting someone who has gone to medical school, they've graduated from medical school, they've completed an internship and a residency, and maybe even a postdoctoral fellowship, maybe they've even gotten advanced training. They may or may not be board certified. Hopefully they are. I believe it is still the case in psychiatry. You have to be board certified in order to practice and call yourself a child psychiatrist, child and adolescent. You have to be board certified to do so because it's a specialty. And so know what you're getting. You're getting someone who can write you a prescription if you need a prescription. And there are many mental disorders for which medication is a part, if not the standard of treatment. And so that's what you're getting if you're getting a psychiatrist. If you're going to a psychologist and searching for a psychologist, know that you're also getting a doctor, but you're not getting a medical doctor. You're getting someone who has a doctorate in philosophy, so a PhD, a doctorate in philosophy, a doctorate of philosophy in psychology, or a PsyD, PSY period D period, which is a doctorate of psychology. The latter degree is a newer degree. It's only been around maybe for, I don't know, maybe 30 years or so. A PhD, of course, is an academic degree. It is conferred by a university. Some universities confer PsyDs. Mostly professional schools will confer a PsyD, although some universities confer those as well. You are getting someone who has studied many years probably at least 4 or 5 years of academic coursework, right? So rigorous reading and study on research and theories and treatment. And they've done several years of supervised training as well. They also have completed an internship. By law, every single state in the union, a psychologist has to have completed an internship, a year-long internship, 2,000 hours of supervised training. And many have completed postdoctoral fellowships. The psychologist cannot prescribe medication in most states in the union, although there are some few states, and when I say few, I literally mean few, maybe a couple, that will allow psychologists who practice in rural areas like reservations. I think the military also has a program where they still train psychologists to prescribe medication. If you go to a clinical social worker, you'll see the initials LCSW or LGSW, the G meaning they're just graduate, they're probably unlicensed. Or a licensed professional counselor, an LPC. You're getting someone who also was licensed, but their education is only at the master's level. So they've had maybe 2 years of coursework and training and supervised experience, and then after that, they're allowed to sit for the license. Now, so people say, well, Dr. Nick, what the heck? What's the difference? How do I know if I should go to a counselor, a social worker, a psychologist? How do I know what I need? I will say that, of course, I'm a psychologist, so that is my optic and perhaps my bias. I try not to be biased, right? I do understand that there are some really very kick-ass master's level clinicians, be it social workers or counselors, some stellar therapists who could run rings around psychologists because that's what they do. But what I would say is that your psychologist really has a depth of training, and I believe to that extent is really trained to go deeper, I think, analytically into some of the issues that people are struggling with, and really has the ability to integrate research, evidence-based research into their practice, to read, to conduct, to interpret, and to integrate research into their practice, much more so than any of the other disciplines. Why? Because it's an academic degree. It's a research degree. You have to do research in order to get a PhD. And so that, of course, is my bias. That, of course, is my optic. Again, no shade to the other professions. I think that there are many, many very stellar master's level clinicians out there. So know what you're getting. That's the first thing. Your medical doctor, your psychiatrist is going to be able to do some forms of treatment that the others simply cannot do because they're not licensed medical doctors or physicians. Medication is one. There are some other types of treatments for some types of mental health disorders that you need a doctor to administrate. For example, ECT or electroconvulsive therapy, which many people know it. The misnomer is shock therapy. We don't like to call it that. It is very, very incredibly low voltage that is sent to certain very specific brain areas. But for treatment resistant or treatment, we call it treatment refractory depression, ECT is pretty much the standard of treatment. Another very recently FDA approved treatment that only a psychiatrist, right? So only the medical doctor can administer is, you might have heard of ketamine being used now. Ketamine, of course, is a drug that has been abused and has abuse potential. It is a hallucinogen. It can cause hallucinations in high doses, but in very low doses, it has shown great promise with a number of ailments to include PTSD and severe anxiety disorders and depression and some other disorders. So that's number one. You got to know what you're getting. Number two, choose your therapist, whatever the ilk, right? Psychiatrist, psychologist, counselor. Choose your therapist like you're choosing a babysitter. If you're a parent, you'll understand. If you're not a parent, you still understand what I mean by that, right? You wouldn't trust your kid. You wouldn't trust any child with someone who wasn't well vetted. My point is you must vet whoever you're trusting your mind with. This is your mind. So in many respects, this is your life, right, that we're speaking about. and your livelihood and your ability to fully engage, right, in this shell that you've been placed in. And so you got to vet the person. What does that look like? What does that sound like? It sounds like picking up the phone and calling and asking some strategic questions. And some of these answers you can get by simply doing, website research or Google research on the person if you have a name, a certain provider. But you want to vet the person. Here's some things you want to ask and you want to know, and be very clear on for yourself. You want to make sure, A, the person is licensed. We've already discussed that. Hopefully no one is advertising themselves as any type of a clinical professional without a license. That would be illegal, and it's important for you all to know that that is illegal. And so if perchance you happen upon someone who is practicing without a license, that is reportable to the state board. So that's number one. You want to make sure they're licensed. You may want to know how long they've been licensed. I think there are pluses and minuses to going to a very junior person or someone who just graduated like yesterday. There are pluses and minuses to that, and there are pluses and minuses to going to someone who's been practicing for 40 years. Pluses and minuses. The pluses for going to someone very junior is because they have very recently been trained. And so they are very much up on the most recent techniques and treatments and research and etc. They are very well versed in that because they just trained, they just got out of school, they just passed a licensing exam that tested them on all of that. So that's a plus. Minuses, of course, they're green, right? When I graduated in what the heck year did I graduate? I got my degree in 1997, 22 years ago. You're simply green because you haven't seen enough of stuff. So things that would stump me then would never stump me now. I've just been practicing. I've pretty much seen it all, right? So, and then conversely, someone who's been practicing 30 or 40 years, I don't know, they're very well experienced, sure, but are they well experienced and well versed in the more recently vetted, researched, and approved techniques to use? Are they as up on that? Are they as up on the research? Are they super burnt out because they've been seeing 10 patients a day for 50 hours a week for 40 years? I just don't know you see what I'm saying? So there are pluses and minuses. You want to know how long somebody's been practicing. Of course, you want to know if they've had any license or ethical complaints, or if they've had any type of restriction or suspension to their license. That is super, super important to know and to ask. You can research that on any state licensing association's website. You want to know what their areas of specialization are. Why? Because I'm looking for a therapist for my kid. I want to make sure that they have a specialization in seeing kids and adolescents. If I'm looking for a psychiatrist for my child because my child is 14 and has ADHD, I want to go to a child and adolescent psychiatrist. I don't want to go to a psychiatrist who's only board certified to see adults. Why? Because he or she may not be well versed on what are the issues that not only that this medication has, some of the interactions, maybe physiological, hormonal interactions, drug interactions, but I also want to make sure that they understand not only how to connect, but what are the issues affecting today's adolescents. That would be super important, right? So you follow me. You want to make sure that you vet the person, that you understand and that they have the expertise that you need and that you can benefit from. I'm trying to think if there's anything else that I want to say that I think are really important questions to ask or to research. I think that's pretty much it. Licensing complaints, again, licensing complaints, license restrictions, revocations, any of that is public record. It has to be by law, and so you can find that very easily on that state. Whatever state you're looking in is where the person should be licensed. So, for example, I live in Maryland. When I was practicing clinically, my office was in Maryland, but I also happen to have a DC license and I have a Virginia license. Should I have not renewed my Maryland license, I could not practice in Maryland. So you need a license. The professional must be licensed in the jurisdiction where they are practicing at. It doesn't matter if my house that I own is in Maryland and I'm practicing in DC. If I'm practicing in DC, got to have DC license. You follow me? All right. So we talked about knowing what you're getting, right? So understanding the differences between the disciplines. And then number two, vetting the professional, very carefully vetting the professional and not trusting your mind, just to anyone. You really want to research. If a clinician, you call them to make an appointment and you say, hey, listen, can you take 10 minutes or so to just answer a list of questions that I have? And they say they don't have time or they're not going to answer your questions. That's not the clinician for you. I don't know any doctor I would ever go to who would say that to me and I would still feel comfortable going to them. Okay, number three. The number three thing that I want you always to know about how to find a really good therapist is that it is not as hard as you think it is. You have many resources. We all have many. We have a network of people we know. We may or may not feel very comfortable asking them, but I guarantee you, most of you know someone who is in therapy or has been in therapy because they told you, and you know that. And so if you feel comfortable enough and you have that kind of relationship that you could ask them. Say, would you recommend your therapist to me? Or if you don't feel comfortable putting your ish out there, I know someone, I have a friend who's looking for a therapist. Would you mind giving me the name of the person that you told me that you saw back when? That's number one. Number two, your primary care physicians for we adults or for your children, the pediatricians that they go to are super good resources of this. Most pediatricians and most general physicians offices have lists of resources, and mental health resources are one of them. And if you ask your doctor and speak to your doctor or to the receptionist in that office, they will absolutely be more than glad to give you lists of referrals. Number two, churches are now becoming more open to having mental health services, many of them right there in their church buildings. If not in the buildings, then they have connections. They can connect you to Christian counselors that they have vetted in the community. And so for those of you that you don't feel very comfortable going to someone who is not a Christian, but you kind of feel like you really do need to go to someone, your church, your pastor, your minister, or someone in one of the ministries in your church edifice should be able to point you to someone. We hope. Churches are really, I think, becoming much more open and much more transparent and much more acknowledging of mental health issues and of what happens when they take a very hard line and say, we're just going to pray this thing away. I think churches now have realized that just is not the answer. So you have those resources available to you. Number four tip. There are some really very good web-based referral sources that I'm going to say here. I'm going to give them to you, and I want you to use them. And on these web-based referral services, you can actually see pictures of, read profiles that these clinicians have written about themselves and their services and the types of psychotherapy that they do. Some of them have pictures of their offices. You can search by insurance companies and carriers that you have. You can search by locale, by area, by zip code. You can search by gender. You can search by area of specialization and clinical need that you think you have. And you can literally do a lot of the vetting right there from these websites. One of them, and I have no proprietary interest in either, I just want to give that disclaimer. One of them is www.psychologytoday.com. The other is www.goodtherapy.org. And they're free to you. The clinicians pay to list themselves and be listed as a referral source, but to the consumer, they are totally free, and they are really, I think, very good and make doing a lot of the research quite easy for people. The other thing I'll say about finding a therapist is this: many people want to use their insurance, and that's understandable. Why? Because psychotherapy. I'm not sure what the master's level clinicians charge. I think they charge about half what the doctoral level clinicians charge. But for me, as a psychologist, my rate when I shut down my practice was $150 per session, per 50-minute session, 50-minute session. And I did not take insurance. And so I understand certainly that can get costly because some people are so acute in their symptoms, they need to be seen many times a week, a couple of times a week at least, or at least once a week. And so it can be pricey. If you choose to go through your insurance, you can search through those websites that I gave you by insurer. You can search using your insurance company, or you can simply go to your insurance company's website or call the 1-800 number on the back of your card and ask the person to help you find a mental health clinician in your locality, near your home or your job, your office, wherever you want to go. If you go on the website, of course, you'll be able to read a little bit about them. I don't think the insurance companies are allowed to have pictures of the providers. I've never seen that, but you can certainly read a little bit about them, where they went to school, how long they've been practicing. And I think that's important. Again, very important information to know. So I think finding a therapist is not quite as hard as people think it is. I think the stigma is what keeps us sort of insular and isolated and not reaching out. But I want to implore you to reach out. I'm telling you, I know some of you are like, Dr. Nick, you just trying to sell us one, right? I'm really not. Many, many people that you know have been in therapy, or they know someone who has. So getting those referrals of people who are good and people that can be helpful to you is easier than you think. The other thing I'll say is this, and I want to leave you with this thought, because myself as an African-American woman, and many of my friends in my network happen to be African-American, not all of them, but many. My family is largely African-American, although I have people in my family who are not African-American or Black at all. But here's what I will say to you. Many people say, Dr. Nick, they'll call me on the phone, friends, people, personal people, and they'll say, I want you to help me to find an African-American therapist. And here's what I will say. I will say, number one, I get it. I get why that statement was made. I get why you think you would maybe want to see someone who looks like you. Of course, as a Black woman, I understand that. Is a shared experience thing, although it's largely an assumption, right? Because there are many patients that I had that maybe assumed that they shared an experience with me because I happen to be Black, and we were just very, very different. So my point is this, and that is to my point. My last point is this. It is not the color or the ethnicity or the racial background of the therapist that drives the treatment and that drives the change. It is the relationship that drives the change. Some of the best therapists that I know that have trained me, and some that have treated me, were not Black like me. They did not look like me at all. And so I just want to encourage people to be open. Now, of course, depending on the issue, right? If I'm coming with a lot of racial trauma, or I'm an immigrant, I get it. There may be sort of psychological and emotional safety issues that might not be best suited if I see someone from the majority culture. I get that. And I'm certainly not suggesting that we just sort of throw those issues out of the window and just, I'm not suggesting that, obviously. What I am suggesting is this. Let's not be close to seeing someone who doesn't look like us, because I think help, and I think health, and I think treatment, and I think better can come from anyone. If I had cancer and my life depended on me seeing somebody, I'm certainly not going to say I'm only going to see a Black oncologist. Maybe the best oncologist in the world happens to not be Black, and guess what? That's who I'm going to go to. So I just wanted to put that out there. So all of what I said was memorialized in a blog that I wrote actually well over 2 years ago. And so I want you to go to my blog site at www.drnick.me, M-E, and scroll through, because it's an old blog, but you'll be able to see all of this information and more. And it's from a series that I wrote entitled Lessons from the Couch About the Couch. And so I think for Minority Mental Health Awareness Month, I'm going to revisit that Lessons from the Couch sort of trilogy that I did, because I think it's an important conversation, important dialogue to have, and I think it's important information that not enough of us clinicians are putting out there. And you know, we sometimes just get a little complacent and we just wait for the phone to ring and we wait for people to call us. Well, people got to know how to find us, and then when they find us, people have to make sure that we are the right fit. Just like you're trying on a wedding gown, I want you to be that careful when you try a therapist and when you select a therapist and when you vet a therapist. So that's it, people. Thank you for joining me. I will upload this to my YouTube channel. Couldn't do a YouTube live tonight, but I will be able to do live in 24 hours. A glitch, I know. Technology. So listen, take care, get your mind right. And for those of you women, don't forget, we've got the Unstuck Summit coming up. www.theunstucksummit.com, 10/19/19. You would want to save that date. There are many women who are stuck, who are literally just dying and just stuck and paralyzed and just, you know, bound by inertia and can't seem to figure out how to get out of that rut. Well, the answer for you is going to be at the Unstuck Summit. So I will see you there. Take care and be well. Thanks for joining me.